In part 1, we have learned all the necessary definitions related to neoplasm and cancer coding, where we have learned what is malignant neoplasm, what is benign neoplasm. And also along with that, we have learned few CMS guidelines related to neoplasm coding. So today we will continue the same. So today's topic is HCC IPOP coding, neoplasm slash cancer, and today we will learn part 2. In the part 1, we have learned until D, primary malignancy previously excised. Today we will start from E, admissions, encounters involving antineoplastic chemotherapy, immunotherapy and radiation therapy. Under E, we have 1, episode of care involves surgical removal of neoplasm. So what is the guideline here? For example, patient is having the breast cancer. So today patient came in and physician has performed excision of the breast. So after performing breast excision, if the patient performs any type of chemotherapy or radiation treatment during the same episode of care, means along with the breast excision, if the patient performs chemotherapy or radiation therapy treatment, we need to code reason for the surgery, so which is breast cancer. So we need to code breast neoplasm or breast cancer as the principal or first listed diagnosis. Basically, you need to remember we can use these same guidelines for outpatient as well as inpatient coding. Next one, how do you code if the patients encounter exclusively for antineoplastic chemotherapy, immunotherapy and radiation therapy? So in this scenario, for example, patient is having breast cancer. So he is having current breast cancer. So patient came in for antineoplastic radiation therapy or chemotherapy or any type of immunotherapy. So that time we need to code therapy code as PDX as well as secondary code as malignant neoplasm of the breast. So that is the guideline here. So we will code Z51 series encounter for antineoplastic radiation therapy, chemotherapy and this one immunotherapy based on type of therapy. If it is antineoplastic radiation therapy, we need to use Z51.0. If it is antineoplastic chemotherapy, we need to use Z51.11. And if the patient came in for immunotherapy related because of breast cancer, we need to code Z51.12 and also we need to code breast cancer as secondary diagnosis along with Z51 series. So what is most important here? First you will code Z51 series code if the patient came in for any type of all these therapies, and secondary code you will code it as breast neoplasm ICD-10 CM code. For example, patient came in for radiation therapy as well as chemotherapy. How do we code that scenario? Okay, so here we need to code both chemotherapy as well as radiation therapy. Among these two, you can take any one as the PDX and next one as the secondary diagnosis. For example, patient is having breast cancer. Okay, so today he came in for radiation therapy as well as chemotherapy. So how do we code this one? So you can code Z51.0 as the PDX or antineoplastic radiation therapy, and also you will code Z51.11 encounter for antineoplastic chemotherapy as the secondary diagnosis, and after that you can code breast cancer ICD-10 CM code. So here this is very important guideline. So here these guidelines are related to if the patient came in for therapies like radiation, chemotherapy and immunotherapy. Whereas sometimes patient came in for brachytherapy. So where physician will implant radioactive elements into the breast cancer site. Okay. So for example, patient is having the breast cancer. So today he came in for brachytherapy where physician will implant radioactive elements near to the tumor. So that time we need to code malignancy or breast cancer as the PDX. Here we will not code Z51.0. So Z51.0 is exclusive for antineoplastic radiation therapy. Okay, so this is the brachytherapy. So that's why we can't code Z51.0 as the PDX here. Now we have the doubt. So here also patient will place radioactive elements, and Z51.0 here also patient will perform the radiation therapy. So what is the difference between these two? So basically in neoplastic radiation therapy, patient will apply like radiation therapy from outside the body. Okay, whereas in brachytherapy, patient will implant the radioactive seeds into the tumor location. So that is the difference between radiation therapy. Patient will send beams or external beams near to the body or outside the body using the radiation mission. Okay, whereas in brachytherapy, patient will place radioactive elements. So that is the difference between radiation therapy as well as brachytherapy. Okay, so next one, patient admitted for radiation therapy, chemotherapy or immunotherapy and develops complications. So patient is having breast cancer again. Okay, so today he came in for anti-neoplastic radiation therapy. So that time we will code Z51.0. So after administration of this anti-neoplastic radiation therapy, patient got nausea and vomiting or dehydration. So that time how do we code? We will code Z51.0 for anti-neoplastic radiation therapy, and we will code all the symptoms code, and also we will code breast cancer code. So here it is second scenario. For example, patient is having breast cancer. Today he came in for or she came in for brachytherapy. And after performing the brachytherapy treatment, patient has nausea and vomiting or dehydration. So in this scenario, you will code breast cancer as the PDX followed by the complication. So what are the complications here? Nausea and vomiting or dehydration. Simple. So next one, F, admission encounter to determine extent of malignancy. So here patient wants to determine what is the severity of the malignancy. Okay. So when the reason for admission encounter is to determine the extent of the malignancy, or for procedures such as paracentesis or thoracentesis, we need to code our primary diagnosis is as malignancy of the cancer or breast cancer as the PDX, even though patient will perform chemotherapy or radiotherapy. So next one, G, symptoms, signs and abnormal findings listed in chapter 18 associated with neoplasm. So as all of us know, every diagnosis has having the symptoms. For example, patient is having breast cancer as well as chest pain. Okay, so that time you need to code breast cancer as the PDX. You will not code chapter 18 chest pain as the symptom. As you can't code chest pain here, chest pain is the symptom of breast cancer. So here basically they are telling if the patient is having breast cancer as well as chest pain, you can't code chest pain along with breast cancer, as chest pain is the symptom of breast cancer. So thank you team. If anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery coding training, IPDRG or inpatient coding training, HCC coding training, CCS certification training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button so that I can create more videos which are essential for all medical coders. And also please share this video with your friends.